Checking for danger, no danger. Checking for response. Baby, can you hear me? Baby, no response. Checking for pain, no response to pain. Just looking in the airway, head tilt, nothing in the airway. Going to feel for a pulse, look for breathing. No breathing, no pulse. Cool. Please, can I get help in an AED? Can you give my 5 ventilations? Plugging this into 15 liters per minute. Cool. No response. I need help, please. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Can you take over ventilations? I'm going to start with compressions. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Ventilation, 2 ventilation.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Ventilation, 2 ventilation.
1, 2, 3, 4, 5, 6.